As I appoila from Victor Hospital, Dr. Rajeshak. He is the one of the best doctor for the diabetes. So तेका आमी appoila आणि ती diabetes check करता, blood test करता, diabetes check करता आणि pressure level check करता, and they give physiotherapy also for the people here. हय आमची पंचायत मेंबर्स सगळी आणि विक्टर हॉस्पिटल ती चडशी आतां ह्या दिसांनी लोक डायबिटीज ना म्हणून चॅकअप करना न्ही. सो जस्ट एक लोकां कडेन अवेरनस करपा कशे खातीर केला आनी डायबिटीज चॅक केली जाल्यार खुबशे लोकांक मागीर मेळटा. आफ्टर सम टायम दे कम टू नो, चड जातकीर दे कम टू नो तांकां डायबिटीज आसा म्हणून. ताका लागून अवेरनस करपाकूय खातीर आनी एक बऱ्या पडा खातीर आमचे फायदो जावन दी म्हणून आमचे विलेजेसां आमी डायबिटीज कॅम्प ऑर्गनायज केल्ले आसा.
We are conducting this camp in Davorlim today for the people of this village. The incidence of diabetes is increasing now. There are a lot of people with diabetes, and nowadays the age group has come down. People with 20 years age, 30 years age are suffering from diabetes. Also, diabetes is a silent disease. So unless and until you do not check, you don't know whether this patient has diabetes or not. So this camp is to screen people to see if they have diabetes by checking their sugars with a glucometer. Also, there are a lot of patients here who have come. They are already suffering from diabetes. They are taking their medicines, but their sugars are not under control. So by checking them, we are finding if the sugars are not under control, we advise them what precautions to take, what diet to follow, what exercise to do regularly, and how to control sugars to prevent complications. Because what diabetes does is it causes lot of complications in human body. It affects the eyes, it affects the heart, it affects the kidneys, and most important, it affects our foot. So what you get is something called as diabetic foot, where people get ulcers, wounds on diabetes in the feet, and because of which many of times they develop gangrene and they have to undergo amputations. So because of which the lifestyle becomes bad. So most important is to prevent formation of diabetic foot. So prevent these amputations. So if they take care of their sugars, if they take care of their feet, we can prevent all these things. So the whole idea of this camp today is to see these patients, to screen them for diabetes, and to see if their sugars are not controlled, give them proper advice to make sure that the diabetes is under control.